is now my pleasure to introduce our Honors Convocation speaker. Dr. David Sarnow was recently named the Interim Deputy Director of the Fulton County Health Department in Atlanta. He is a preventive medicine physician and public health emergency officer with 20 years' experience in the United States Air Force. Throughout his career, Dr. Sarnow has demonstrated a strong ability to coordinate and lead diverse expert team members in task management and to communicate complex topics clearly to a lay audience. Dr. Sarnow graduated from the University of South Florida School of Medicine, and after completing his family medicine residency, he completed his MPH from UAB in 2005. He also completed an aerospace medicine residency and general preventive medicine and public health residency at the United States Air Force School of Aerospace Medicine. Dr. Sarnow has served in a number of leadership capacities, including Chief of Aerospace Medicine for the 19th Medical Group, United States Air Force, Little Rock Air Force Base, Chief of Aerospace Medicine for the 8th Medical Group in Kunsan, South Korea, and was selected as one of 3 special trainers for the first ever Iraqi flight surgeon training that trained elite Iraqi Army and Air Force physicians in aerospace medicine. We are indeed honored to have Dr. David Sarnow as our Fall's Honors Convocation speaker. And David, thank you for your years of service to our nation.
I want to start out by saying I'm really excited to be back here at UAB. I mean, it was 10 years ago, but it really honestly was one of the best years of my Air Force career, coming back here and being a student again. Ask me, you guys can catch me offline and ask me later about my UAB war stories, and I'll be happy to share. Well, I was asked originally to kind of tell you how I got here, but I think Dr. Michael has actually done a fairly good job of giving you my background. But I will say a couple of things first. That I started out in medical school, and in the 90s in medical school, I had no idea what public health was. Nobody did. If you said, hey, what do you think about public health? I would have said, what? What is that? And then I went to do a family practice residency with the Air Force, and you know what? The same thing held true. I still didn't know really what public health was all about. It was focused on clinical medicine. You have a patient come in, you treat them, you send them out, and you go on your way. Now, family practice did have the advantage of looking at the whole family as a unit rather than the individual patient and dealing with it a little bit more broadly. After I did my residency in the Air Force, I was lucky enough to get a job as a flight surgeon with Special Operations Command. This changed a lot of things. I won't go into detail on what a flight surgeon is in this forum, but I will tell you that for the Air Force, the flight surgeon is the frontline occupational medicine, public health, and preventive medicine physician. So I got thrown headfirst into trying to understand how preventive medicine and public health works both at the home base and in the field. I had technicians who taught me how to do water testing. I had technicians who showed me how to do a restaurant inspection. I mean, I was actually getting hands-on on the basic stuff that was, not what I would even have thought of at the time. I got to see, from going to such diverse places as the exotic locations like Savannah, Georgia, and the more mundane locations like South America, Southeast Asia, and the Middle East, to see where public health fits in firsthand, to understand really the difference between the type of environment I grew up in and how different it can be in other places. After I did those things for about a decade, I decided to myself, I really like this. I like looking at things from a community medicine perspective rather than from a clinical medicine perspective. I want to expand what I did. I continued to do primary care clinical medicine for about a decade, but I mixed it up. Every time we went out somewhere, whether it was a long deployment or a short deployment somewhere locally, we had a public health element to what we did. Whether we went out in advance and looked at our food sources, went out in advance, looked at our water sources, tried to figure out how we were going to set up where we were going so that we could keep people healthy. After that, as Dr. Michael said, I actually went back and did a second residency. The first part of that residency is a master's in public health. Then I got lucky, I got to come here. Oh, I had a great year. But again, more on that later. After that, I did a second year in aerospace medicine and then a third year in general prev med and public health, which I got board certified in. The last decade of my career prior to retirement was focused largely on the policy level. I was a base level chief of aerospace medicine. That sounds more complex than it is, but really you oversee both the clinical flight med program, preventive medicine program, the public health program, industrial hygiene program, health and wellness for the base, and most importantly, you're the public health emergency officer, which means that you start working on plans and policies for deciding what's going to happen when the zombie virus breaks out on your base. How do you work with the local communities on containing the zombie virus, and how do you treat it? A large part of it was exercises. Well, I retired this summer and was lucky enough to get the job with Fulton County. Maybe lucky. Well, that has yet to be seen. But it's a challenge. Fulton County is a county of almost 1 million people, and it encompasses most of metro Atlanta and several other communities, has the largest population of indigents, largest population of folks with chronic disease, and it is quite a public health challenge. There's a lot to look at and a lot to learn and do. So when we were sitting there, where you guys are sitting, and I still actually kind of remember that, most of my colleagues were trying to figure out what they were going to do with this MPH. Where am I going to go from here? Well, the 4 of us in the class who were military, we kind of knew where we were going. We didn't have a lot of choice. But most of my friends and classmates weren't always 100% sure. Some were thinking of going to med school. Some had some ideas where they were going to go. The others were going to say, let me see what's out there. I wanted to talk about 3 basic, in my mind, there's 3 kind of basic places you can go with public health. And all of them have some merit and value, but I want you to think about them. The first one is what I like to call the long reach outreach. This is the sexy stuff. I'm going to some faraway place. I'm going somewhere in some remote village somewhere, and I am going to help build them an infrastructure. I'm going to help teach them how to do things better so that you can keep their population healthier. You've got an opportunity to make a lot of impact in doing something like that. You also have a lot of barriers to doing stuff like that. There's not a lot of opportunity out there, and then you have to do a lot of coordination to see if you can make it work. You have to make sure that you can plan and control and decide what's actually going to make that kind of impact. The second big thing I like to call domestic field work. This is the movies. If you've seen Outbreak, if you've seen Contagion, if you've seen any of those, this is the movies. This is our guys, CDC and stuff, who go to local disasters, who go to outbreak investigations and get there on the field and do something. Try to provide input to the local public health, to the local hospitals to figure out, hey, how can we make a difference here? How can we make things better? This is active emergency response, and I'll be honest with you, this is a lot of what I planned and made policy for as part of the Air Force. In a lot of ways, especially when you're doing it as a tabletop and simulation, it's really exciting. When real lives are involved, it gets a little bit hairy. But I guess fortunately for us, disasters don't occur every single day. So on the downside, if that's what you're doing, your job isn't going to be that 24/7. You're going to be prepared for it, you're going to be planning for it, and you're going to be doing some other things as well. The last part is the local public health. Local public health could be county, could be city, could be state, it could be whatever your focus is, whatever your scope is, whatever you're interested in. It's you bringing your public health home to you. This might seem on the surface less exciting. There's not going to be a lot of TV shows or movies about local public health, but it really is the backbone of the practice of public health, honestly. You may be creating the framework for these responses. You know, in the county or on the base, I'm doing essentially local public health, but I'm creating the framework for emergency response. Without that framework, without knowing what your resources are, you can't just run out and respond to an incident. Or you may be looking at what are the needs in your location. Some of you may stay here in Birmingham. Others of you, in my class, we had folks go all over the place, San Diego, Louisiana, all kinds of places. Wherever you end up, you're going to be looking at what the needs of your community are and trying to focus your admittedly limited resources, and it's always going to be limited, on what's going to help and make the biggest difference in your community. And I think, to quote my instructors over here, to do the greatest good for the most people. You guys have probably heard that one before. So anyways, all of these 3 areas really build on each other. I mean, they don't exist in isolation, and you may still find where you're going to head out. They all have their own challenges. They all have their own satisfaction. Remember, though, you are your greatest advocate. You guys have all heard this before. Public health is invisible when it works. Because when you walk outside right now, you know you can drink the water. You know the vast majority of the food you're going to eat is going to be safe. But that's because we have a constant public health infrastructure keeping that happening. All it takes, and I've heard this quote before, it's not my quote, so I'm not going to claim it, you know, we are one disaster away from being a third world country. I mean, for those of you who remember Katrina, you know, it doesn't take much more to think about that. But when you're trying to convince the folks that are making policy, the folks that are making budgets, the folks that are really running the show, that public health is important, it's hard because they don't see the effects of it day to day until something goes wrong, and then it's too late. So you guys are the biggest advocates for whatever you end up doing. You may already know the path you want to take. You may already have some kind of idea. You might even have a job offer waiting for you when you get out of here. For those of you who don't, keep your eyes open. Things that you may not have thought about may entice you. I never thought about public health. I made a career out of it. So keep your eyes open, keep your focus, try to figure out where you want to be. I'm sure you're all going to be a great asset, and I'm hoping to work with you all in the future. Thank you very much.